Hello, this is a quick video about the supply of over-the-counter medicine. There are a lot of P medicines and many GSL medicines, so it's difficult to remember all of them, the legal restrictions, the indications, the contraindications. So I've got this framework for remembering the restrictions for over-the-counter medicine. So I use this acronym called RAID. So RAID stands for Referral Criteria, age restrictions. For example, supplying omeprazole for under 18 is illegal. Indications. So many medicines are licensed for all sorts of conditions, but you can supply only for a specific condition under P medicine license. So the dose, especially for paracetamol and ibuprofen, for kids. So it's really important you remember if there are sex specific conditions. For example, if a medicine is only licensed for female patients or only male patients. So this video doesn't cover everything, but it's just a pointer on how to revise or to remember conditions for supplying OTC medicines, especially P medicines. So as you can see, all these medicines are only licensed for over 18 for patients over 18 years old. For example, omeprazole, Nexium, Losarel, prochlorperazine for migraine, tamsulosin for benign prostatic hyperplasia, Orlistat for obesity and weight reduction. So if you go on, these medicines are only licensed for over 18 years of old. Especially, you need to be very careful with medicines that contain salicylates because they are all contraindicated for children under 16 years of old because of Ray's syndrome. Especially aspirin and all medicines that contain, for example, Bonjela for adult. I think it contains salicylate, so you need to be aware of not to supply for children under 16 years old. Also, Voltrol, azithromycin is a special condition. It requires a positive diagnosis of chlamydia. Also, Zantac, Pyrenees, fluticasone, and I think Becanase as well. So you need to check that as well. Also, Imodium is licensed for only children and adults over 12. Umovate for eczema and dermatitis. Decongestants like xylometazoline and pseudoephedrine and ephedrine. Oragel for toothache. Also, antitussives are also contraindicated for and antihistamines as well for children under 12 after the change of the licensing conditions. Also, codeine and dihydrocodeine are contraindicated for children under 12, at least under the P medicines law. So, if you look at a difference between POM licenses and over-the-counter licenses, so as you can see, for over-the-counter license, medicines can only be supplied under a specific condition. For example, if you look at naproxen, if it's on a prescription, you could supply it for the treatment of rheumatoid arthritis, acute gout, dysmenorrhea, other musculoskeletal conditions. But under P medicine, you can only supply for women aged between 15 and 50 years of old, and for only 3 days, maximum 9 tablets for a whole cycle. So if you supply a naproxen for say pain or toothache or any other condition, you are supplying it outside its license, so it's illegal. The same for prochlorperazine for migraine. So you need for under a POM license, it's indicated for all sorts of things: vertigo, Meniere's disease, labyrinthitis, nausea, vomiting from different causes, schizophrenia. But under P license, you can only supply it for migraine, which has been diagnosed by a doctor, for adults over 18 years of old. The same for omeprazole. It's used for all sorts of things, but under P medicine, it's only licensed for short reflux symptoms. And as we said, doses, you need to remember paracetamol and ibuprofen, especially stating the maximum dose. You could easily just read the packaging, so it's easy to find out. Topicals, hydrocortisone, Umovate. Remember not to apply on the face, genital parts, on the eyes, ears. So also remember single dose. They are very easy, like Ovex, the mebendazole and fluconazole, the canesten capsule for thrush, Also, remember omeprazole, ranitidine, omeprazole is only once daily tablets, especially under the P license, or chloramphenicol doses, which are used every 2 hours for the in waking hours for conjunctivitis. Um, so remember, doses for paracetamol and ibuprofen are really important. Remember the doses and the frequency, the gap you need to give, the interval between the doses. So it's really important. Otherwise, if you don't remember, it might come in an exam, and you might, not be able to answer that question. So referral groups, basically, if someone has a severe or significant disease like hypertension, diabetes, or asthma or COPD, they are usually a referral criteria. If someone's hypersensitive, pregnant and breastfeeding ladies, patients over 65 or 70, varies with license, of treatments like warfarin. So Dactarin is used for mouth candidiasis. So if someone has um, a mouth a fungal infection and you give Dactarin, it's really really dangerous. So you need to think of conditions where the medicine is contraindicated with someone who's taking other POM medicines, NSAID with aspirin. So because remember, ibuprofen negates the effect of aspirin used in the prevention of MI and strokes, and uh, basically for its antiplatelet effect. So alarm features: someone has GI bleeding, weight loss, or any history of ulceration. Any change is an alarm signal. Any change in bowel habit. So patients over 45 or 55, dysphagia, broken skin or infected skin, use on the face, as we've mentioned before. Also, the duration of action is usually 7 to 14 days. Also, some of them could be used for up to a month, so you need to check these. And conditions where the medicine needs to be diagnosed before you supply a medicine. And these are quick tips. So paracetamol and aspirin, the maximum pack size you could give as a P medicine is 100. There's no limit on the number of liquid medicine you could give for paracetamol, Nurofen, but it depends on the professional judgment. Ephedrine and pseudoephedrine, maximum 180 and 720 respectively, and you could only give one single pack. Codeine, dihydrocodeine, is only for 3 days, and you could give only to patients over 12 years old, and the maximum pack you could give is 32. You can't sell two pack size at the same time. And as we said, these are all sex-specific OTCs like naproxen for women, tranexamic for women, tamsulosin for men, fluconazole, the fluconazole capsule for thrush, although it could also be used for candidal planitis for partners, but it's mainly used for thrush in women, as I've seen. As we said, naproxen is only for women as well. So remember these sex-specific conditions. Also, azithromycin, as we have mentioned before, it's only used for patients who've been diagnosed with chlamydia and their partners. Also, as we said, just remember this mnemonic rates for each medicine, and then it should be easier to remember when the medicine should not be supplied, where it's outside its licensed conditions.